And on that note, we are at 2 o'clock. We do have several more scheduled to join us, but again, in respect of everybody's time and busy schedules and maybe a little sunshine this afternoon, we will go ahead and get started. I'm Julie Sanderson, and I'm the event director for the Toledo Regional Chamber of Commerce, and I'm very pleased to welcome you here today. This is our second in our series of webinars planned to keep you up to date and help you understand the COVID-19 vaccine as it relates to businesses and your employees. This series is in partnership with the Employers Association and the Chamber and the V Project. And if you haven't heard about the V Project yet, I'll give you just a little bit of background. If you joined us last week, this will be a little repetitive. But the V Project is a community initiative to educate, motivate, and vaccinate the entire Northwest Ohio corridor to dramatically slow the spread of the COVID-19 virus. To accomplish this, leaders from industry, government, and nonprofit and healthcare, education, religious organizations have all united in this unprecedented effort to effectively mobilize our community with the goal to vaccinate 70% of our population. Medical experts agree we need 70% vaccination rate to get to that herd immunity that allows us to be safe and helps our businesses, organizations, and community members thrive, again, without restrictions. There are more than 250 community leaders involved in the V Project and more joining the effort every day. The business and industry community is just one of the many facets of the V Project, and the Chamber and the EA are both part of this committee. And together, we have assembled a panel of experts to provide an overview to help businesses understand the benefits that the COVID-19 vaccine offers and how to navigate the challenges and complexities associated with the vaccination process as it relates to your business and employees. I'll now introduce Terry Vanier, a seminar learning manager at the Employers Association, to introduce our panel of experts who are joining us today.
Well, thank you, Julie, and good afternoon, everyone. Today we are pleased to have back with us for this week's panel, Brandon Polinsky, Planning and Quality Improvement Administrator with the Toledo Lucas County Health Department. Brandon will get us started here shortly with an update on the health and science aspect of the vaccine, as well as the status of distribution. Next, we will hear from labor and employment law attorneys Ray Arce and Carl Habekost. Ray is an attorney with Marshall Melhorn and is a member of the firm's labor and employment law practice group. He has over 25 years of experience in labor and employment law, including construction industry labor law, OSHA matters, and litigation in state and federal courts. Carl is an attorney with Bugbee and Conkle and is the head of the firm's labor and employment department and represents employers in all aspects of safety law, workers' compensation law, and employment law. Then finishing out the conversation this afternoon is Andrea Gurcsik, Senior Manager, Global Talent Acquisition with First Solar, the largest manufacturer of solar modules in the world. In this capacity, she is responsible for the global talent acquisition functions, including recruiting, branding, talent strategies, and social media. Currently, she serves on the board of directors for the Ronald McDonald House Charities of Northwest Ohio, the American Heart Association, the Employers Association, and the Ohio Society for Human Resource Management State Council. We are honored to have each of you with us this afternoon, and we thank you for taking time to share your expertise with us. At this time, Julie, we'll turn it back to you.
Yes, certainly. Thanks, Terry. Before I turn it over to our panel, just a reminder to keep your microphones on mute to eliminate some of that background noise that we sometimes get. And in terms of questions, you can either just jot those to the side or put them in the chat. We will have time for questions and answers, but we'd like to do those at the end because there's a good chance your question might get answered along the way. And also, we are recording this session. I will send the link to everybody. Usually takes about 24 hours, but then you'll be able to refer to that, share it as you would like to. But just remember, all the information is accurate as of today, March 10th, as you'll hear from our speakers as we go along. This information is ever changing and ever evolving, so I just want you to be aware of the timestamp on this. But with that, I am happy to turn it over. I'm going to unshare my screen here, and we will go ahead and welcome Brandon, who will get us started.
All right, thank you, Julie. Can you hear me okay?
Yes.
All right, so I am going to share my screen as soon as my camera is not blocking the button. There we go. Okay, and you can see the PowerPoint? Very good. So this will be a little bit repetitive, but the information is updated from last week, and I'll jump right into that. So as I stated last week, we are getting closer and closer to our 1-year anniversary of our first case, which is on March 14th. We also are unfortunately getting closer to our first documented death. Our total cases as of today, the data we pulled today, are nearing 36,000 in the county. Over 30,000 of those are from PCR confirmed tests. Those are the ones that look at the genetic code of the virus. And another close to 5,500 are probable test individuals who had all the signs, symptoms, and a direct link or a direct link to someone who was positive. Our total deaths are currently at 777. For those who watch the data daily, you would have noticed a large jump from 2 days ago to today. A lot of those deaths are actually from last year, December, November, even a couple in October, because it does take that much time sometimes for the death data to become finalized to actually get to us. So a good portion of those are from last year. But with that being said, 40% of all our deaths are from the beginning of December last year to now. So a good proportion of those are from the latter part of last year and into this year, considering we started last March. Our total tests conducted are closing into 150,000. Those are tests that we know about. Testing sites are not obligated to report every single test that they run, only the tests that end up positive to the health department. So those are the testing sites that do report regularly to us since the beginning of the pandemic. The number in reality will be higher because not everyone is required to. If anyone in your organization needs a test, you can follow that link on the bottom of the slide. And we have all of the testing sites that want to be listed publicly on our site available there. This is a snapshot of pretty much everything. So each of these green bars represents a single day, and it represents the number of cases we had come in that day by the test result date. So you can see when we started the pandemic, there's one little green dot over here on March 14th. And then we had our spike in early to mid-April. It kind of calmed down into June. We had another small hill come up in August. And then we came to the least fond memories we have at the health department in November and December, when our cases were exponentially exploding off the charts. So it did start to come down towards the end of December. We had that slight bump just after the new year from the holidays. And right now we are much happier seeing the case just on that downward slope. We're hoping that it stays there, but we are watching that daily and trying to mitigate that as best we can. This is a 30-day rolling average. I have no idea why a couple of the numbers are larger than others, just how it pasted over. So that 24 and that 63 have no special significance. But what you see on this chart is this is also by test result date, and this is the most recent cases per day. That tan shaded region are the ones that are the 3 days most likely to change. Like you'll see on 310, there's 0 cases. That's just 0 that we were reported to us as of when the data was pulled today. And that's not uncommon. It usually takes a day or two for those test results to get to us. So in that tan region, those numbers are likely to change, but it is promising to see on 3/7 that we only had 12 cases come in, and that in general, our 2-week average is sitting at 45 cases per day. Back in November, December, we were close to 300 cases per day as our 2-week average. So if that gives you an inclination of where we've come from recently, We're hoping it stays there. We're hoping it decreases further. So everyone keep up with your intervention methods, and I'll touch on those a little bit. But it is working. Vaccination, we believe, is playing a role, but it's hard to say how significant that role is yet with this case number versus people just actually doing what they need to. And also the warmer weather. I really like today. I got some windows open in the department. It's very nice here, so it brings a little bit of fresh air. This map is on our website. We update it most every day. And this just shows you kind of a per capita, making all of our zip codes comparable to one another. So we did it by 5,000 residents. Last week, there actually was a few green spaces in this map. So this one does shift and change almost daily, depending on what cases come in. There was a lot more yellow and a few green last time. So a couple zip codes are seeing a slight increase in cases, but as we see with the average, we're hoping that stays kind of where it is. It hasn't started to go up really recently, so that's been absolutely great. In terms of helping to keep that caseload down, obviously our goal at the health department, our goal for the community is to help reduce the chances of COVID transmission, reduce the cases, and get rid of it if at all possible entirely. And those gold standard measures are things you've heard ad nauseum. I'm not going to cover them all, but coverings, distance. For those individuals, it's something that always amuses me kind of when I see these messages like, well, if 6 feet works, why do we have to wear masks? Or if masks works, why do we have to do 6 feet? And the reason is because those work collaboratively together with one another. If you're wearing a face covering, that's what makes the 6 foot distance effective. And we'll talk a little bit. I heard a little bit of commentary at the beginning of the call about how vaccination might change some of these precautions. And I'll get into that in just a moment. But keeping up with this and also supporting contact tracing, I've been quarantined twice throughout the pandemic. Fortunately, I have never developed COVID, but there were 2 exposures where I had to do the quarantine. I know how much it really sucks to stay in one place for 14 days and have to ride that out. But it really is for the health of the community to do that. Okay. Moving on to COVID variants, there's still 3 major ones that the global community is watching. We are seeing more of these appear in the US. As of today, I pulled this data a little bit earlier. We've seen a little over 3,200 cases of the United Kingdom variant, and 61 of those in Ohio. And too far. One of the newest things we've seen as well is we now have 1 case of the Brazil variant in Ohio as of the last time that data set was updated on the CDC's website. So some of these variants are making it here. You probably have heard that the variants are more contagious. They do seem to spread easier, but they do not appear, as far as we know, to produce any more severity of disease at this time. Or any more likelihood of complications and death. So that at least is good. The part of the variant that actually changed a little bit is that spike protein, which is what the vaccines are also fighting against, what they try to create antibodies to. And I'll cover that in just a second, how that impacts, those variants might be impacted. Vaccination in Lucas County. So as of yesterday, this data is sometimes updated by now, sometimes it's in the early afternoon. As of yesterday, we've given over 79,000 first doses in the county, and that's between all 3 vaccines. The vast majority of those are going to be Moderna and Pfizer. We just started getting Johnson & Johnson last week. But yeah, that's almost 18.5% of our Lucas County population, over that with today's vaccinations. But 18.5% are now vaccinated, and almost 11% are now on their way to being fully vaccinated, that 46,000 for the Moderna and Pfizer. So that's really great. Those who did receive the Johnson & Johnson 2 weeks after those shots, pretty much about 2 weeks from last week, will also be counted in that full immunity. In Ohio, Lucas County still is 6th for overall number of first doses given, which is pretty expected when you consider We have Franklin County, Columbus, Cleveland, Cincinnati. Those are the places that they've just given the most vaccines by number. But as far as percent of population vaccinated with those big cities or big counties, Lucas County is first in the state. Some of the smaller counties have higher percentages of their population, just the way the math works out. But for the big urban communities, we are leading that charge, which is very cool. Okay, we are trying to address equity with the V Project. I won't say much more about them because I know we have a representative from them, but we do allocate so many vaccines out of the allotments we get from the state every week. And we're really working with those community partners and especially the V Project to help address any of those equity issues and really making sure that those most affected by this disease are getting what they need to help combat it and be healthy. Okay, that was a shout out from last week. The state actually listed us in the top 10 and the top 5 as far as making sure we're reaching out to those other communities. And here is something that I'm sure a lot of you have heard of, and if you didn't hear the details, the eligibility criteria will be updating tomorrow. The eligibility criteria now includes anyone over the age of 50 years old. And the other part that was added is that phase D medical group, type 2 diabetes and those with end stage renal disease can also now be vaccinated starting tomorrow. I know some individuals may have started to sign up, and typically the week those are going to go into effect, those appointments don't get canceled or pushed back just because by the time they get the vaccination, they'll have been eligible. But every Thursday is when that eligibility goes into effect. One of the things too that we want to start emphasizing for people who say, well, I want this particular vaccine or that particular vaccine, the best vaccine is the one that's really available to you. We're going to be seeing shifts in what we get from our state allotments right now. And since December, it's all been Moderna and Pfizer. We got some Johnson & Johnson last week, about 300 doses in last week. But I wouldn't be surprised if the majority of our vaccines in the near-ish future are more skewed towards Johnson & Johnson versus Moderna and Pfizer. And we don't know exactly the distribution of those allotments we'll get. So those who don't have a medical reason to get one vaccine over the other, because the J&J is slightly different in the way it's made than Moderna and Pfizer. If you can get a vaccine and you're eligible, we just encourage you to do it. And not worry about specifically which type it is if you don't have that medical necessity to get one over the other. We have a chart too, and this was made in conjunction with the V Project. This flyer, I have a small picture of the whole flyer, and I can send that to Julie. But I blew up this understanding the difference of the 3 different vaccines. So J&J is a single dose, Moderna and Pfizer are both 2. Time to full vaccination, 2 weeks after J&J. The reason Moderna and Pfizer say 35 and 42 is it's because 14 days after that second dose. So Pfizer has 21 days between dose 1 and 2, and Moderna has 28 days between dose 1 and 2. And then 2 weeks after that second dose is when you will achieve that full immunity, as it's being called at the CDC and around other places. You'll notice too, as far as preventing symptomatic COVID, J&J has a lower percentage, but again, you don't necessarily want to get hung up on the percentages. We very much like numbers. I mean, I'm a data person. I like to see the hard numbers of things, but in terms of will a vaccine help you, the simple answer is yes. And one of the best things that we've seen is that last line there that those who have been vaccinated who have gotten COVID or maybe got it between dose 1 and dose 2 for the Moderna and Pfizer, it's really, those vaccines have really helped prevent hospitalization or severe medical need. And as far as we know, no death has occurred from those individuals from COVID who have been vaccinated. So that's absolutely fantastic. It's great hope for the future. One of the other things to add at this point is that I know some individuals will say, well, I've had COVID, why should I get the vaccine? One of the best reasons you might have is the cross protection. So I mentioned those variants and how a few of the variants or all of them are more infectious, which means they spread easier. All three of these vaccines have shown cross protection. It's not as effective as the strain that they made the vaccine against, but it still will reduce that disease or the symptomatic burden that you experience if you were to get COVID from one of those other variants. And there's also, this question came up today elsewhere, so I thought I would just share it. If you do have COVID, there is no time that you need to wait before getting vaccinated, as long as you have reached the end of your isolation period and you're not symptomatic anymore. So some individuals I know that if you've had COVID, you don't necessarily need to get the vaccine immediately. You could wait a month, 2 months, just to let that natural immunity ride out a little bit. But there's certainly no restriction on you getting it as soon as you're out of your isolation period. If you are eligible, you can schedule a COVID vaccination at the top of the health department's website. It's on every page, but most of our vaccine info, if you're looking for additional information, is that /COVID vaccine. But that little schedule appointment button is at the top of every page. If individuals do need help, there is 211, there is United Way, or that's the same thing. There's 211 and the area office on aging to be able to assist individuals. I know that based on call volume, both of those entities are doing the best that they can to keep up with everyone wanting the vaccine. So please be patient if you call and you may get a busy signal, or just you have to try a couple times. Other than that, we're full steam ahead. We're vaccinating as many as we can, as quickly as we can, and most of our feedback has been pretty positive in terms of the efficiency of it. If you're going to one of our vaccination sites, from the time you arrive there, it's very reasonable you'll be leaving within 35 minutes. And that includes waiting in line, waiting for 15 minutes after your vaccine, and then out the door. Occasionally it's a little longer, but really an hour is the absolute max I think anyone has really had to wait at these sites. So they're very streamlined, they're very efficient, whether you do the hospitals, the rec center. We've held some pods at the ROTC building at UT. They're very good for that. With that being said, that's the end of my initial update. I actually want to pull up a question that Julie sent me ahead of time. So with the CDC, this is the question, with the CDC saying it's now okay for people who have all been vaccinated to be in the same room without masks, will that override the mask rule in workplaces? And does it change if we can't ask employees if they've been vaccinated? So the second part of that question, I'm going to leave for the legal experts on this call. But in terms of the first part, if you have two fully vaccinated individuals together, meaning they're 14 days past that second dose of the 2 or the 1 dose of J&J, they do not need to wear a mask in the vicinity or worry about that 6 feet of distance. The CDC is still recommending, if you are in a room with unvaccinated individuals or even high risk unvaccinated individuals, that everyone wear masks for their safety, because while the vaccines have shown a great protective measure in terms of spreading the virus, it's still not 100% guarantee you might not spread it if you had it, or just facilitate one of those higher risk individuals becoming ill. So that is the recommendation in terms of that question. Anyone who's fully vaccinated can breathe a little easier, so to speak. So other than that, I haven't looked at the chat while I was presenting. Are there any more questions that came in? Let's see.
I believe our chat questions were answered. It was a request for the links, which we'll also send out in the email when we share the link to this recording. So again, keep those questions coming, but in interest of time, we will go ahead and move on to our legal experts.
Ray, you muted.
Thank you. So I'll go first. My name is Roman Arce. My nickname is Ray. And Carl Habekost is going to help me with this presentation. And Carl has graciously asked me to go first. let me put on the screen for our screen share. I did a very short PowerPoint presentation. So everyone can see that, right? Let me do this to it. Yes. Okay. So maybe that's not the best way to do it. Yeah, that works. Is that okay?
Yep, that's
Okay.
good.
Okay. So what I'm trying to address here, and I think there's a lot of communication, there's a lot of opinions about this out there right now from attorneys who specialize in this area, labor and employment law, and there's a threshold question. So if employers want to get employees vaccinated, want to encourage employees to be vaccinated, want to get people back to work, is that overall effort a wellness program? So so a little bit of background, both under the Americans with Disabilities Act and under the Genetic Non-Discrimination Act, GINA, wellness programs must be voluntary and they must be for the benefit of employees, as a general way to say that. And when you look at the definition of wellness programs, both under GINA and the ADA, the EEOC has been giving us guidance on this since 2015. The first couple of slides I have here is straight from the EEOC guidance under GINA. And probably the principal thing here to notice is that GINA is about genetic information or just history, of the manifestation of a disease or disorder in family members of an employee. So that, the minute you get into family members' medical history, then that implicates GINA. Whenever you ask employees about their own medical history, their own medical information, then that implicates the ADA. That's, disability type information. And with wellness programs, the EEOC has said they got to be voluntary, right? So both, whether you're looking at it from the GINA standpoint or from the ADA standpoint, the EEOC enforces both. And ever since 2015, the EEOC has been telling us that those programs, those wellness programs, have to be voluntary. And then on this screen, you've got a pretty broad definition that a wellness program must be reasonably designed to promote health or prevent disease. So at first blush, a vaccination program is meant to prevent disease. So there's a lot of commentary that the wellness program regulations apply when employers are doing the COVID-19 vaccination. And the EEOC issued guidance in 2016 that in addition to be voluntary, it must be, more the EEOC said, as you see on the screen, what a wellness program must not be. It must not be to benefit the employers. It must be to benefit the employees. It's got to be voluntary, and it can't be overly intrusive or burdensome on the employees. And then there's a little drama here. So those EEOC guidance enacted in 2016 were overruled in 2017. And this is all pre-COVID. So this is before the pandemic. And this all left employers wondering or, a little uncertain about what they can do to incentivize employees' participation in a wellness program. So January, 2 months ago, the EEOC issued two separate proposed wellness programs. And this was, right before Trump left office, and the EEOC issued these rules under both the ADA and under GINA. And these rules kind of concerned employers because after being overruled by a federal court, the EEOC's proposed rule here very much limited the incentive that would be considered permissible. And the example that the EEOC gave in those rules is that anything more valuable than a water bottle or a gift certificate gift card of nominal value would violate the law. That would make it non-voluntary. So this, raised a question. And then the EEOC last month in February withdrew these rules. So that left everybody wondering, and you've still got attorneys out there saying that, it's that the vaccination program is a wellness program and that you cannot provide too much of an incentive, financial incentive, because that will run afoul of the EEOC regulations. And the point, I want to make here is that I'm not so sure, because the EEOC has done a number of things. And I have on this slide, last March and April, the EEOC issued pandemic-related guidance. I'm sure you're all familiar with, that guidance. And that was before we had a vaccine. And then in December, the EEOC issued additional guidance. If you log onto the EEOC website, these are question and answer format, and the list of questions and answers keeps getting longer and longer. But the ones from December 16th of 2020 did address the vaccination and the vaccination issues. And, what was a little bit frustrating is the EEOC didn't come right out and say whether a vaccination program is a wellness program or not. However, the EEOC did say that it is a safety-based qualification standard, the requirement or and the EEOC says you can make it required. It's a little bit surprised people. EEOC says, yes, as far as we're concerned, you can make it voluntary. We consider it a safety-based qualification standard, and that an employer can do that so long as, it's designed to prevent a direct threat to the health or safety of individuals in the workplace. And if you look back at the regulations, the guidance that the EEOC issued last March and last April, the EEOC was very specific that the threat of the spread of COVID does pose a direct threat. So it would have been nice if the EEOC had just flat out said that, yes, it's a direct threat. I've quoted here on the screen here that the EEOC says that to be a safety-based qualification standard, the employer would need to establish that the presence of unvaccinated employees in the workplace would pose a direct threat. And I think when you tie the two together, I think that, the EEOC is telling us pretty clearly here that we can mandate vaccination. We can definitely ask employees whether they've been vaccinated. That's right in the questions and answers from the EEOC. And that, at least in my view, that, whether we're talking about applicants for employment or employees, a safety-based qualification standard only has to be job-related and consistent with business necessity. And at least from my view, I think that, that level is established. And I disagree a little bit with those who are of the view that, if you give employees $100 to get vaccinated, if you give employees an extra vacation day, an extra 2 days of vacation if they become vaccinated, I kind of doubt that that's going to run afoul of the EEOC regulations. I think there's a big difference between a wellness program where you're trying to, help employees to live a healthy lifestyle, maybe, delay or prevent the onset of diabetes and other diseases that are not contagious. Diseases that are not infectious are not going to run through your workforce and maybe kill people. I think that the COVID vaccine is something that is far more dangerous, and I can't fathom that it would be held to be illegal to incentivize employees to get vaccinated. Let me move on. So on the final screen I have here, I just throw in, so what does the EEOC expect? I mean, they've given you employers a lot of leeway here to require vaccination, to ask employees to be vaccinated. What they do emphasize, though, is that you've still got to think of those individuals, in the workplace who have a reason not to be vaccinated that's based on a disability or based on a religious belief. And the EEOC says that if there are reasonable ways, the obvious one is let them work from home, for example. You know, employee says, I can't be vaccinated because I have a disability and the vaccination itself, you know, would harm me. So, okay, you can't force that person to be vaccinated. You got to go through the traditional interactive process under the ADA and figure out if there's a reasonable way to accommodate the person. If that person has been working the last 10 or 11 months from home anyway, you know, I think you're going to be hard pressed to say, well, we can't let you work from home anymore. That would be an undue hardship. It'll depend on the company. I mean, you know, depending on the circumstances, maybe a company would be able to say, look, we put so much time and effort to getting people back in the workplace that if we allow unvaccinated employees to continue to work from home, that's going to cost us money, inefficiency, hardship. You know, there may be a way to get there, but one size does not fit all. You're going to have to consider the circumstances on a case-by-case basis and decide if you can accommodate folks. And you may end up deciding that, okay, we can accommodate an unvaccinated person who works, you know, they're a grounds person, they're a maintenance person. You know, one of the main things they do is they're outside by themselves cutting the grass. You know, that's just an example. I mean, you could accommodate that person. But if we're talking about somebody who has to do home visits with elderly folks, you know, that's a main part of their job and they have to be in very close proximity with elderly folks. Yeah, that's a much different question. And there may not be a way to accommodate that person. And the only thing I'd throw in on the religion side is remember that it's the same concept, except for religious accommodation, employers don't have to incur more than a de minimis expense. So the hurdle's a little lower on religion. If accommodating somebody's religious objection to being vaccinated, if that would cause even a little bit of hardship and cost, then, you know, you've got a more legitimate way to say no. You know, we're not going to do that. That's it in terms of my slides. I would mention this sort of to you know, I'll turn it over to Carl. There are some interesting things in the EEOC guidelines that were issued in December in terms of what is or is not ADA protected information or GINA. And the key is, so employees being vaccinated, you know, just receiving the shot, that doesn't implicate ADA, that doesn't implicate GINA. It's a safety-based qualification standard. You can do it. But every time somebody goes to get vaccinated, and you know, some of you know much more about this than I do, they fill out, the person being vaccinated fills out a questionnaire about, you know, have you had cancer? Have you had diabetes? You know, your health history. And the minute you ask the employees that, then that's ADA protected information. You got to have a job-related reason and consistent with business necessity to ask those questions. And I think that's already established. But then it's all got to be highly confidential. And then if the pre-vaccine questions ask questions about family members' medical history, and I don't know if that's, you know, really going to happen or not, but that's GINA, and that's highly restricted. And, you know, basically you can't do it. So I would try to stay away from that. Final point, if an employer sets about to vaccinate employees themselves, you know, or they contract with a healthcare provider to vaccinate their workforce, then you're responsible for all of that. You know, the ADA issues, the confidentiality issues, the medical questionnaires, you know, that the employees fill out. However, if you're an employer that says, okay, go get vaccinated yourself, you know, go to the health department, go to whatever you got to do, we're hands off. All we want to know is, you know, confirmation that you've been vaccinated. That actually loosens things up a lot, because then, you know, you're not responsible for the questionnaires. You don't get any of the, you know, disability related questions that the employees fill out. It's much easier from the EEOC standpoint for employers to go that route and just say, you know, get vaccinated on your own and then prove to us that you've been vaccinated. I'll turn it over to Carl. I think I've taken more than enough time.
All right. I will be quick. I do not have PowerPoint slides. There are a couple of things I want you to remember about COVID-19 vaccines and safety in the workplace. I'm going to use more acronyms. Think about this. Think about all the acronyms we've already talked about. EEOC, ADA, GINA. I'm now going to throw in two more, OSHA and BWC. All of this presses down on the workplace. And as HR professionals, you know more than anyone, the burden that the regulations and the government agencies place upon you in trying to deal with your employees in the workplace. I have one point about OSHA and how these agencies issue guidance and proclamations, maybe not in communication with the other agencies. OSHA is a federal agency. Some states have their own state-run agency, like Michigan does, MyOSHA. In Ohio, it's OSHA. Doesn't matter, it's all the same law, basically. OSHA issued guidance January 29th, 2021. They said, as part of their 15-page guidance, that making a COVID-19 vaccine available at no cost to all employees is highly recommended. Now, that may be important when I get to the workers' comp scenario. And OSHA also said you are not to distinguish between vaccinated and non-vaccinated employees when it comes to continuing safety protocols. That means wearing facial coverings, hand washing, 6-foot distancing. So I don't know how that fits in with the CDC guidance. I think it does, but OSHA didn't really clarify that. So that's OSHA's position. And they throw that in under this big general duty clause where they say every employer has an obligation to provide a workplace to their employees that are free of recognized hazards. And as part of that big catch-all phrase, OSHA comes into the workplace and says, you've got to protect your employees. We strongly recommend you provide vaccines at no cost to all your employees, and you still follow safety protocols. Now, let's talk about workers' comp, because I don't know if that's going to be part of your presentations in the past or in the future. But the vaccine could be a workers' comp issue. And Ray Arce and I were talking about this before the presentation today. Every little change in a fact can change the analysis. And I know HR people dislike at times talking to attorneys because we can't give you a black and white answer most of the time. Most of the time, it's not like 1 + 1 = 2, because if you pull a 1 out of this stack that has maybe a different color on it, you pull a 1 out of this stack that has a different color, you might come up with 2, but it'll be a different color 2 than if you pulled them out of these other places. And that will change the legal outcome. So let's do this. I put this together. Let's say that you're the employer and you mandate vaccines. You contract with a company to come into your workplace, you pay for the vaccine, and your employees get the vaccines while they're on company time. You have an employee that has a severe reaction to that vaccine. Is that a workers' comp claim? Probably. What do you think, Ray? Would that be a workers' comp claim? You got to unmute.
I defer to you, but it sort of harkens back to the wellness program and stuff. Is it voluntary or not? If the employee on their own is going to get vaccinated and the employer asks, have you been vaccinated? And that may have consequences to where they can work and whether they got to wear a mask or whatever. But I think that's not a valid workers' comp claim, entirely, voluntary. The minute the employer makes it mandatory or even maybe incentivizes it heavily, then maybe it is a workers' comp claim.
Right, exactly. The analysis is Did the injury occur in the course of employment? In course of is a geographical analysis. They were at the workplace. So yes, it was course of. Did it arise out of employment? Well, yeah, they were getting paid. The employer mandated that they have it done. So that very well could be a workers' comp claim. I wanted to bring that up. I know we're out of time, but the vaccine has all sorts of relationships that go beyond just protecting that individual against the COVID-19 virus. And that's my point. OSHA, BWC, and all the other acronyms. So if you have any questions, you have our contact information. Thank you.
Let me throw in one more thing. I think we all know Ohio did pass an immunity statute. So for those employers that, do the vaccinating themselves, and I'm not talking about workers' comp, because you can never make yourself immune from workers' comp. But, if you've got somebody trying to make a claim about the side effect of the virus, there is an immunity statute in Ohio that's in effect until September 30th, I believe. And it's a pretty strong immunity statute for stuff like, vaccinating employees. Well, it's not specific to employment, it's just in general. So
Right.
That's it.
Good point.
Okay, Andrea, why don't you go ahead and jump in there? You have some things to share?
Yep. All right. Well, thank you. I kind of thought, maybe it'd be helpful if we shared some of the things that First Solar has done during the beginning in the past with COVID, and then what we continue to do, and maybe what we're talking about for the future. And I'll try to just, in the effort of time, to make sure we have some time for question and answer, just share things that I think are a little bit unique. So I won't focus actually much on the past, but I will say that one thing that's ongoing that we started that in the past was really looking at our benefits program and increasing that. We added a lot of changes to our benefits program, and we really looked at it in 3 buckets: time off, pay, and benefits. We gave 2 extra vacation days to all non-exempt associates that were required to work on site and didn't take our voluntary layoff. We converted what we have as emergency time off to vacation time and added extra hours to emergency time off. Again, these were benefits for, at the time, those who did not take the layoff. We also doubled our parental paid leave policy during that time. And we have an extraordinary circumstance leave policy that we expanded for more coverage and things to be covered during that time. And our pay, we added overtime, 2 times of overtime pay for hours worked outside of regular schedule. We gave a weekly bonus for an incentive. We also did things like weekly drawings, and we extended our military pay leave 3 times. We increased it by about 300%. So we were proud to do that. And then a number of associates that were called up to active duty at the beginning of COVID. And then our benefits, for those of our associates that did not take the layoff, we paid their weekly contributions during that time. Like most, we stopped our 401k loan deductions. We also increased our financial wellness program. It's a benefit that we already had, but we really increased the visibility of it and asked for specific webinars on specific topics that we got back through surveys of our associates of what was important to them. And we did offer some other things that aren't as notable too. So, but we continue to virtually onboard all of our non-manufacturing positions. And we have evaluated that over time just for some business continuity, but we continue to do virtual interviewing. Our policy continues to be work from home. If you can, you should. We had a work from home policy before COVID, but we introduced a new program called Flex, which stands for the F is for full-time office, L is for limited office, E, external office, and then X is for when the offices are closed. And this is a brand new policy that really allows more flexibility that we didn't have in our work from home. There's no applying for it. There's no approvals. It's now part of our culture to work from home. So months ago, we stopped those monthly emails that we were all sending of 1 more month work from home. So we did those things. We also, on our benefits thing, I did forget to mention, we have a backup care benefit in our health plan for child care or senior care. And we did increase that, and we also promoted that more, and our telemedicine policy also. And we recently, just at the beginning of this year, changed our EAP provider to one that was a little bit more robust during this time. So we also, our communications was huge for us with most of our workforce, off-site, and we're global too. So a lot of things I'm talking about were benefits here in the United States, because I thought they would be the most applicable in this situation. But our communications, we already had traditional communication streams that we did, monthly communications, weekly, but we added one called What You Need to Know. And it was actually a daily communication. We're down to weekly now, but in the first 6 months or so, we got a daily update on what you need to know, whether it was for work, home safety, childcare, things like that. And we've done, I mentioned, a couple of surveys. And then really we're focusing now on, we did a good job of the work from home transition of allowing folks to come back in and get their computers and their multiple screens. We're spoiled with 2 or 3 monitors each, and to come home with just a laptop, so we allowed them to take home equipment and sign it out, come in and get office supplies. But we've really been challenged, and we continue to, of how do we build this collaboration? So I thought I'd share a few good ideas that some of our teams had during the last year. So we have a couple departments that do open cubicle meetings. And what those are is they get online, and we use WebEx and Microsoft Teams. So they create a team meeting twice a week for a couple hours. So it's a 3-hour block for the one, twice a week. And everybody on the team jumps on and they just work. But that way, if they have a question, it's like being back in the office. You can just speak up and talk. So that's been a unique thing that they've done since the beginning of this COVID experience here. We've had Secret Santas. They did Secret Santas in the summer, they did Secret Santas in the fall, and then your traditional Christmas one. We've had departments do virtual baby showers, things like that. So it's been neat to see how creative our associates have been about creating that engagement. And as we look for the future, we're really focusing on a few things of, right now we're evaluating offering paid time off for folks that do want to take advantage of getting vaccinated. We're also working with the Wood County, we're located in Wood County, Health Department for on-site vaccination, because we're such a large employer. So we're working through that and hoping we can offer that. We're also looking at long-term our office design. What once was, we're a cubicle company from our CEO down, but is that still what we want to do going forward? So we're looking at different options of maybe we don't have cubicles, but we have common meeting areas, and different groups get a day of the week to come in to use those areas. And just probably like a lot of you on the call, looking at ways to continue the engagement as work from home continues. So those are a few updates about what we're doing at First Solar. If there's any questions, I'd be happy to answer them, or anything more you'd like to know about what we're up to.
Thanks, Andrea. That's helpful to know that. I think a lot of companies are looking at providing some time off for people to go get those. I think that's probably been the most common type of benefit or incentive that the people have been coming in. There's one question that did come in, probably more for the one of the attorneys here, and I have my opinions about this, but I'm always careful not to try to give a legal opinion here, since I'm not an attorney. But it says the question is, just to clarify, is it the employer or the employee to determine that the unvaccinated employee would pose a direct threat? My thought here is we could potentially not be able to provide our services needed to be done in person if a majority of staff chooses not to get the vaccine and decide for themselves that they need to work from home. Does that make sense? Just wanted to make sure it is the employer's determination. So Ray, or you want to check in or tell me what you think, or Carl?
Yeah, I mean, I have been, into the ADA side of this, and yeah, it's definitely the employer, the right, so to speak, or the well, really, it's a duty. The employer's got to decide whether an unvaccinated employee presents a direct threat. I think the EEOC, the EEOC has said that, if the employees are working in close proximity with each other, that, yeah, absolutely, it's a direct threat. And that was before there was a vaccine. So when the EEOC said that last year, there wasn't a vaccine and said, yeah, this poses a direct threat. So it's got to be the same answer now. Unvaccinated employees, assuming that the unvaccinated employees are still going to be a minority in the workforce. There's still going to be a lot of unvaccinated employees in the workforce. Then yeah, it's a direct threat. And then the burden on the employer is to realize that you got to drill down to the circumstances of your case and the employee involved. What's the job entail? Do they work in close proximity with others? Do they work in close proximity with people, at risk of dying from the, low risk, high risk? There's these different considerations. But yeah, it's the employer's determination, and it can be challenged. So the employer makes the determination. Unvaccinated employee, they get less hours, they can't work a preferred job, maybe they end up getting paid less. The most extreme, maybe they lose their job altogether. They can challenge that. They can file a charge, file a lawsuit. But anyway, I think I've answered that.
Okay, good. Carl, anything else you want to add to that?
Sure, Bob. And this gives you an insight on what it's like to hang around with lawyers while they're having drinks. I agree with what Ray said on the ADA, but I'm going to come at this from yet another federal government agency's viewpoint, OSHA. The employer has the absolute burden to make sure that they have a workplace that is free of recognized hazards. The ADA gives the employer the obligation, as Ray said, to determine whether someone is a direct threat. Well, what does direct threat mean? An unvaccinated employee running around your workplace who may be very close to other employees and they're not vaccinated would pose a risk of substantial harm or even death to your employees in the workplace. So that very well could bring not only the EEOC in, but you have OSHA in.
Yeah, well, in OSHA and your circumstances, the OSHA is saying, don't let the unvaccinated employee in close proximity.
Absolutely.
Yeah.
Andrea, one quick question for you also. Are you sensing that First Solar is going to change anything about remote work once more people become vaccinated, or are they leaning towards continuing to allow people to work from home even after we have widespread vaccinations?
Yeah, so I don't think we made a final decision, but I think we're leaning towards more of what I talked about, of having these opportunities to come back in the office, of having days where different departments can come back in. But it'll be interesting. I'm not certain we'll ever go back to full-time back in the office like we had done before.
Yeah. Yep. And that's what I'm hearing.
I mean, honestly, I don't know how many employers can answer the why, if you do, you know what I mean? When we've done it for almost a year, why do I have to come back? And we have done a lot of surveys, and I think it was close to, don't quote me on this, I think close to 90% of our associates that are working from home were okay with continuing to work from home. So, or wanting it, I should say.
Yeah.
Well, and that would fit in with folks who don't want to be vaccinated. So they like working from home. They don't want to be vaccinated, and they may want to work the rest of their career that way if they can.
Yeah. And as Andrea can attest, you better have good remote work policies at this point.
Yeah. Yep.
Yeah.
All right, Julie, I think we're ready to wrap up. We did pretty well. We have 1 minute left. Look at there. We thought we were going to run out of time.
We do have 1 minute left, and I don't know if you could see me like this because I was frantically taking notes. I did see somebody did put in the chat that they're interested to learn more about the Flex program. And that was one of the things that I wrote down as well. So Andrea, I don't know if that's something that you have on a one-pager you can share with me. We can send out a little bit more about that, but or if you just want to take our last minute and tell us a little bit more about it.
I'm happy to do either. Let me just pull up all the information so I don't misstate anything here on our Flex. So I guess, is there specific questions on the Flex that I might be able to answer? Maybe that's a better start.
No, it just said interested to learn more of the details.
Okay, so it's called Flex because we are constantly changing. So it's situational and business environment driven. That's kind of our key. So we've really been, for solar, we've been working like this for years. So I want to say that for us, we're kind of like, well, we've been doing this because we have a lot, we're global. We had a lot of people that worked remote prior to this. So for us, it's just kind of introducing that this is the new norm, is that working from home. Kind of, again, we're not telling people this is a date to come back. We're just going to allow this policy. So the act, as I mentioned, really talks to full-time office. That says that, hey, you can work from our full-time office with the facility full-time. Our L, the limited office, is that you can work from home part of the time. You can work from First Solar offices part of the time. And then the E option is external office. So you work from home remotely full-time, and you can visit the First Solar office as needed. And then offices closed, so we're work from home full-time, and offices are restricted. Like right now, we're in phase X of it, of the offices closed. What do you want to call? Okay, stop. Sorry, this is working from home. Your son walks in the door and tries to give you a hug. So you're witnessing it. But yeah, so those offices closed. So we have different phases of it. And so like right now, we are in the X phase of the offices are closed. As things open up, we will, kind of like backtrack into that. And you can choose which option works best for you when we're out of the X. So, this is, I want to say it's not so new, it's just more formalized from us. Where our previous work from home policy was you had to fill out a form, you had to get your manager supervisor, your executive leader's approval, the hours had to be defined, the days had to be defined, where this is more open and flowing and kind of just going with it. So I see this being our future of kind of, once we open up the offices, we'll be at a level and you can choose F, L, or E of what you want to be, and you'll be hired in at a different level, so.
That's fantastic. I again was taking some notes and appreciate that feedback. So we did have one comment in there, and I do understand that this can be if I understand the comment right, onboarding somebody brand new and that training and the contact with other employees here at the chamber. We've had 2 new hires since we've been in a work from home, and we keep saying, I've never met you in person. I see you on screen all the time. So navigating some of those challenges as well.
But I think offering your associates, we've worked hard to, especially being in charge of the talent, of providing managers resources of what they should do. You should have a team meeting on video. We actually schedule in my department twice a week for an hour, just catching up time, where we don't talk about business. We just talk about it because you miss that, not working in the office together. So, what are your kids doing? And my team requested that. They said, we put these pamphlets together for managers that are hiring people remote to make sure that they are seeing each other and doing these things to keep them engaged, because it is a challenge. It's a different work environment. So, it takes effort. It takes a manager effort.
Yes, it sure does. Other than that, if there are no other questions, I do see that if there's a question to have contact information from our attorneys who presented, and we're recording this presentation and happy to share all of that. Give us about 24 hours to get the link to the presentation out and the deck and those types of things. But thank you again for attending with us, and to our presenters, and for all that great information. We really appreciate it. Everybody enjoy some of that sunshine the rest of this afternoon, and have a good day.
Yep. Thank you, everybody.